Hello, and welcome to Public Health Matters, a monthly program dedicated to discussing public health issues in our community. The program is sponsored by the Middle-Brook Regional Health Commission, which serves Bound Brook, Greenbrook, Middlesex, South Bound Brook, Warren, and Watchung. My name is Colleen McKay-Wharton, and I'm the health educator for the Commission and host of the program. Our goal for Public Health Matters is to give you a program that will provide you with useful information to help you better understand important public health issues, and in particular, what you can do to reduce any risks associated with them. The month of May is Allergy and Asthma Awareness Month, and we'll be speaking with two members of the Pediatric Adult Asthma Coalition of New Jersey, also known as PAC-NJ. Dr. Torre, pediatric allergist, who is the PAC-NJ co-chair, represents the New Jersey Allergy, Asthma, and Immunology Society. Also joining us is Sandra Fusco-Walker, and she is the New Jersey representative for the Allergy and Asthma Network Mothers of Asthmatics. And she also serves on PAC-NJ as the chair of the Community Task Force, as well as on the coordinating committee. Thank you both so much for joining us today. This is such a critical public health issue, so we appreciate your time. I understand that living and breathing with asthma is clearly becoming more and more, it seems, of epidemic proportions. And I only just recently became aware of the role of PAC-NJ and what this organization, the coalition, does. So I'm wondering if you can share a bit about what activities you get involved with.
Asthma, when you look at it, is actually the most common health problem that we see, especially in kids.
Okay.
And it's becoming more and more of a problem. Asthma is growing more in youngsters less than 18 than any other age group. So the Asthma Coalition started off looking at kids as our primary goal to help somebody. And there's a lot of organizations doing lots of things for asthma. The goal of PAC was to bring multiple organizations together, essentially a clearinghouse of 70 different agencies or groups interested in helping people, originally just children, with asthma.
But now I notice the name is not just pediatric, it's pediatric adult. So
right. So we actually added the adult. Actually, as part of our ability to get CDC grant money, we had to look at all age groups. And children grow up to be adults anyway.
Absolutely.
So, the asthma will be growing and growing, not just in the children, but as they grow up, we'll see more and more adults with asthma as well.
It's interesting that you just mentioned the CDC funding, and I will, as many of our viewers may realize, the CDC is our largest public health entity in the country, and there are so many organizations like yours that are not your typical health department providing public health services, but organizations such as PAC-NJ that is very sort of targeted towards a specific health issue, doing really critical public health work. What are some of the activities that that the coalition members are typically involved with?
Well, the funding is interesting because it serve some basic functions, but all of our members are really volunteers. So we have each organization kind of does what they can do on a volunteer basis to get the most information out there. As a clearinghouse, essentially, we primarily provide information. We've divided up into several groups: a community task force, school task force, child care, physician insurance company, a way to get information to each of these vital areas to make asthma care better for the state as a whole.
Can you give us first just a basic definition of asthma? How do you define that?
Actually, I'm going to give you two definitions.
Okay.
The original one is old age definition, and it was a bunch of episodes of bronchospasm. And that's the way many people still view it today. But the real current definition is asthma is a chronic disease of inflammation. Added on top of the inflammation then becomes an overreactive airway where you start to have symptoms like coughing, wheezing, shortness of breath. But the key is that it's a chronic illness and it really deserves chronic therapy, much like high blood pressure, diabetes, etc.
Now, can you share with us a little bit of some statistics on how many children are impacted? How does it impact their daily living?
If you look at some national data, up to 9 million children have had the diagnosis of asthma by the time they're 18 years of age. And that's probably a number that's way low. And many times children come in with inhalers for wheezing, but there are other diagnoses given to them. So the number is probably considerably higher than that. And out of that number, about 10% end up in an emergency room, which nobody should really have to do. Our medications work so great if you're under control, and that's the key, control, that you shouldn't ever need an emergency room. 3 to 5% of kids actually end up in the hospital each year, hospitalized. Again, something that should never happen. And if we look at deaths in general, 10 people die a day of asthma, a disease that should kill no one.
Wow. Those are some profound numbers, really, and clearly that's reflecting the broad public health epidemic that I hear it being referenced to quite often. Do we actually know what causes asthma? Or, I mean, we tend to think of some triggers, which we'll be speaking about in a bit, but what is it that's kind of at the root cause of it?
Well, there's a whole lot of illnesses that are probably lumped together in the syndrome of asthma.
Okay.
But basically, it's an inflammatory process. So like inflammation that would occur with arthritis or other kinds of things, you have this ongoing chronic process of your body overreacting. We're not sure of the actual cause that starts the inflammation going. We know there's a genetic predisposition so that if your parents have allergies or asthma, the child's more likely to get it.
Okay. Okay. But if a child has asthma, it doesn't necessarily mean one of their parents had it.
No.
Right, so it's,
but it is
typically there, okay. Now, you mentioned sort of the episodes that may happen, you know, it's a chronic illness, but certainly I think have all seen a child or even an adult have an asthmatic attack, for lack of another word, an asthmatic episode. Are there certain triggers? Sandra, I know you in your role have done a lot of education of parents and consumers. What are some of the common triggers that would actually result in that?
Well, every person's asthma can be triggered by different things, and it's really best to go to your allergist and be tested to find out exactly what your triggers are. But the most common ones tend to be dust mites, mold, some environmental things that are in your home or at school. And there is also the big triggers of pets. Pets can be a real problem with families. And, of course, tobacco smoke, which is a huge trigger for people with asthma.
Well, you know, let's go back to each of those, and let's talk a bit about what someone can do. If we were to say, if I had a child with asthma in my house, dust mites, I cannot begin to imagine how I would keep that under control. So how do we help a family address that? That's seems insurmountable to some extent.
It does seem insurmountable, but the wonderful thing is when you when you get educated about asthma and you work with your medical provider, you create a plan. And part of your plan is looking at your home once you know what your triggers are and taking care of the things that will bother you. PAC-NJ has some things on our website that you can certainly go to find out about ways you can control asthma in your home. For instance, if you're allergic to dust mites, you would cover the mattresses and the pillows that you sleep on at night and make sure that they're covered so that the dust mites can't get out and bother you. You regularly clean up the dust because you wouldn't want dust in the house. If you are allergic to mold, you want to make sure that in your bathrooms and showers you're wiping down and cleaning up and there's not letting any mold build up anywhere.
And that's really an almost daily basis.
Well, pretty regular, but you know, it's maintenance and cleaning, and doing those small things can make a major difference in allowing you to have your asthma under control. So it definitely helps. If you are allergic to pets, you may have to find another home for your pet. That is, you know, usually the best way to do that, rather than take medicine to keep a pet. You also.
I'm sorry. Interestingly, with pets, I have heard people say that, you know, I'm allergic to cats, but there are certain cats they're not allergic to. So is it, if someone is officially diagnosed as having allergies to cats, is it across the board, or is there somehow distinctions between the types of pets that they may not actually be allergic to?
I'll let the allergist answer that.
Okay.
Okay. Well, actually, the part you're allergic to, is the skin cells themselves. Also, that same allergen is in the urine and the saliva, so it's the whole animal. There may be some animals that might seem to have more allergen than others. For instance, black male cats are probably more allergenic than white female cats. But they're all allergenic. There's no such thing as a non-allergenic you know, animal like that. So.
Interesting. Now, you were mentioning, you know, certainly with pets, the difficult decision might have to be made. Is there something, is it enough to keep a pet out of your child's bedroom, or probably
it's
not?
Really not. You know, if you have a pet and your child is allergic or you're allergic to a pet, they shed their skin cells and they leave it all around the house. So keeping it out of the bedroom is not the optimum way to handle that.
Okay. And there's some interesting discussions about tobacco, and certainly we know there are so many health